Welcome to our deep dive into canine electroencephalography, or EEG. And specifically, we're going to be talking about the challenges and the need for standardized electrode arrays when we're talking about canine EEG.
Yeah, you got it. It's really all about understanding the electrical activity in a dog's brain, which is really important when we're thinking about diagnosing and treating epilepsy.
And in human medicine, EEG is really the gold standard for diagnosing epilepsy, and it guides all the treatment decisions, whether we're talking about medications or even surgery.
Absolutely. And it lets us identify specific epilepsy syndromes in humans. Each one has its own kind of unique characteristics and treatment strategies, and that's really something that veterinary medicine is still working towards.
It seems like veterinary medicine is lagging behind a little bit. Why is there this gap in fully utilizing EEG?
Well, one of the main challenges is that idiopathic epilepsy in dogs is primarily diagnosed based on what we see, the clinical signs, and that can lead to misdiagnosis, especially when we're dealing with some of the more subtle seizure types, like focal seizures or absence seizures. And there was a study that showed that even experienced veterinary neurologists looking at a video of a dog having a seizure had a hard time agreeing whether it was a seizure or not.
Wow, that's concerning. So how does the current diagnostic process in veterinary medicine actually work?
So the IVETF, the International Veterinary Epilepsy Task Force, has a three-tier system for diagnosing idiopathic epilepsy in dogs. But the problem is that EEG is only used in that final confirmatory step. It's tier 3. It's not being used to its full potential early on to really help guide those treatment decisions.
So we're missing out on valuable information that could lead to more effective treatment. And that's even more crucial when we're thinking about drug-resistant epilepsy, which affects a significant percentage of dogs.
Absolutely. And that's really where this need for precise source localization comes in. So for those dogs that have drug-resistant epilepsy, surgery can be an option. But we need to know exactly where in the brain those seizures are coming from.
And how is this source localization actually achieved?
So in human medicine, we have the standardized 1020 electrode array system. This has been the gold standard for decades. And the way it works is electrodes are placed on the scalp at very specific intervals based on skull landmarks. And this allows us to create an accurate map of the different regions of the brain. So we can really pinpoint the origin of those seizures.
So this standardized system in human medicine allows for targeted surgical intervention. What's the situation like in veterinary medicine?
Unfortunately, veterinary medicine has historically lacked that standardized equivalent to the human 1020 system. And this lack of standardization has made it really difficult to compare findings across different studies and institutions. You know, there's been variability in electrode placement and just a lack of that really consistent methodology. So it's been hard to build that really solid body of knowledge.
So have there been any attempts to address this issue and develop a standardized canine EEG electrode array?
There have, and those efforts go all the way back to the 1980s. Some of the early attempts, like the 5-electrode array that was proposed by Redding and Knecht in 1984, had very limited brain coverage. It's kind of like trying to understand a complex puzzle, but you only have a few pieces.
So better brain coverage is key. What about some of the more recent developments?
So in 2004, Pellegrino and Sica introduced a 12-electrode array, which was definitely a step forward, and it aimed for better coverage and even tried to use a nomenclature that was analogous to the human 1020 system. But validation studies like one done by Daniel et al. In 2013 revealed some inconsistencies in how those electrodes were placed and the overall coverage.
So even with the 12 electrodes, there were still limitations. What happened after that?
So James et al. Further refined the array in 2019. They increased the number of electrodes to 15, which allowed for even better coverage. And they also made some adjustments to improve patient comfort, which is really important, especially when we're talking about recordings that are done without sedation. But even with these newer arrays, we still need to do thorough validation studies to really figure out how accurate they are when it comes to source localization.
So are there any specific challenges in applying the human 1020 system directly to dogs?
Well, that's the burning question. Dogs, unlike humans, come in a wide variety of skull shapes and sizes, especially across different breeds. And so trying to directly translate that human 1020 system, which really relies on those specific skull landmarks, can be really tricky.
Yeah.
You know, just think about the difference between a brachycephalic breed like a bulldog and a dolichocephalic breed like a greyhound. Their skull structures are vastly different.
That makes sense. So this variability in skull shapes poses a significant challenge for standardization. Are there any other anatomical factors that we need to consider?
Absolutely. So unlike the human scalp, which is relatively immobile, dog skin is much more elastic and mobile. So that means that even if you very carefully place those electrodes, they can shift during the recording as the dog moves, and that can introduce errors into the readings.
So how can we account for these variations in skull shape and skin mobility in dogs?
Well, researchers have been looking into the idea of an EEG cap specifically designed for dogs. And this cap would help to hold the electrode securely in place and minimize the impact of skull shape and skin movement. So it essentially creates a more standardized and controlled recording environment.
This EEG cap sounds really promising. Are there any studies that actually support this idea?
Yeah, there's a study by Leon et al. That was published in 2020, and they showed that using either a headset or a commercial elastic strap cap could actually help to maintain that electrode placement in dogs even when they were moving around.
That's a huge step forward. It seems like creating this standardized EEG system for dogs is a pretty complex challenge. We have to think about the anatomical variations, and we also need a reliable way to keep those electrodes in place during the recording. So what are the big implications of actually achieving this standardization?
Well, I think it would be transformative for veterinary epileptology. First of all, it would really improve our diagnostic accuracy, being able to more precisely identify those different seizure types and where they're localized in the brain, which is really crucial when we're trying to come up with the right treatment plan.
So we can move away from just relying on those clinical signs, and we have more objective data to help guide our treatment decisions.
Exactly. And it could also potentially lead to us identifying specific epilepsy syndromes in dogs, just like we do in humans. And that would open up a whole new world of possibilities for developing more targeted therapies that are tailored to each individual patient.
That level of precision could really revolutionize the way we manage epilepsy in dogs. What about the potential for epilepsy surgery? You mentioned earlier that source localization is really important for that.
Absolutely. A standardized EEG electrode array is essential if we want to make epilepsy surgery a viable option for dogs. If we can accurately pinpoint where those seizures are coming from, surgeons can target that exact area of the brain, and that minimizes the risks and increases the chances of a successful outcome.
So it's like providing the surgical team with a really clear roadmap to guide their intervention.
Exactly. And it goes beyond surgery, too. Standardized EEG could help us develop new therapies and medications, and even things like neurostimulation techniques specifically for dogs with epilepsy.
It's really about unlocking this whole new era of treatment possibilities.
That's the crux of the matter. It has the potential to really change the lives of so many dogs that are struggling with this condition.
This has been a really insightful look into canine EEG. We've talked about the challenges, the advancements, and the potential that this technology holds. But what does the future hold for canine EEG research and clinical practice? What are some of the things that are on the horizon?
Well, there are a lot of exciting areas that people are looking into. One promising area is the development of more advanced EEG analysis techniques. So we're now seeing the integration of artificial intelligence and machine learning into EEG analysis.
How would these technologies enhance our understanding of canine EEG?
Well, imagine algorithms that can sift through huge amounts of EEG data, and they can pick up on these subtle patterns that might be missed by the human eye. And these algorithms could do things like identify early warning signs of a seizure, or predict how a dog might respond to different medications, and even help us to personalize treatment plans based on a dog's individual brainwave signature.
So we're really talking about taking canine epilepsy treatment to this whole new level of precision and personalization.
Exactly. It's all about leveraging the power of these advanced technologies to improve the lives of dogs with epilepsy.
This deep dive has really highlighted the importance of continued research and innovation in canine EEG. But beyond just treating epilepsy, what other possibilities does this standardized EEG system open up?
Well, it could really revolutionize our understanding of the canine brain as a whole. If we have a reliable way to measure brain activity, we can start to really investigate the complexities of canine cognition and behavior, and even their emotions.
So we could gain these deeper insights into how dogs think and learn and interact with the world around them.
Precisely. It's like unlocking the secrets of the canine mind. Imagine being able to map the neural pathways that are involved in learning and memory, social interactions, and even the bond between dogs and humans. This knowledge could have profound implications for things like animal welfare training methods and our understanding of the human-animal connection.
It's amazing to think that a tool that was initially designed to study and treat epilepsy could be the key to understanding so much more about our canine companions.
And the research doesn't stop there. Another really interesting area is exploring the potential for developing canine-specific EEG databases. So just like in human medicine, where large EEG databases have really helped to advance research and diagnostics, we could create similar resources for dogs. And these databases would let us compare and analyze EEG patterns across different breeds and ages and different health conditions. And that would give us an even deeper understanding of canine neurology as a whole.
It's like building this comprehensive library of canine brain activity, which could lead to some really groundbreaking discoveries.
Exactly. And all of these advancements could have far-reaching implications. They could benefit not just dogs, but other species as well. The knowledge and the technologies that we develop for canine EEG research could potentially be adapted and applied to other animals. And that would really broaden our understanding of animal cognition and behavior across the board. It is a fascinating question. The advancements that we've seen in human epilepsy treatment, from, those precise diagnostics to the targeted therapies, and even surgical interventions have been remarkable. And I think a standardized canine EEG system could really open the door for those same kinds of breakthroughs in veterinary medicine.
So we're talking about potentially transforming the lives of dogs that haven't responded to any of the conventional treatments.
Exactly. Imagine a future where epilepsy doesn't limit a dog's quality of life. That's really the vision that's driving this research.
It's an inspiring goal. This deep dive has really highlighted the importance of continued research and innovation in canine EEG. But beyond treating epilepsy, what other possibilities does a standardized EEG system open up?
Well, it could really change how we understand the canine brain as a whole. If we have this reliable way to measure brain activity, we can delve into those intricacies of canine cognition and behavior and even their emotions.
So we could gain deeper insights into how dogs think and learn and how they interact with the world.
Precisely. It's like we're unlocking the secrets of the canine mind. Imagine being able to map out those neural pathways that are involved in learning and memory, social interactions, and even, the bond that forms between dogs and humans. That knowledge could have a profound impact on animal welfare training methods and, just how we understand the human-animal connection as a whole.
It's incredible to think that a tool that was initially designed to study and treat epilepsy could hold the key to understanding so much more about our canine companions.
And the research goes even further than that. Another really exciting area is, the potential for developing these canine-specific EEG databases. Just like in human medicine, large EEG databases have been really instrumental in advancing research and diagnostics. We could create similar resources for dogs. And those databases would allow us to compare and analyze EEG patterns across different breeds and ages and different health conditions. And that would give us this much deeper understanding of canine neurology in general.
It's like we're building this library of canine brain activity. And that could pave the way for, some truly groundbreaking discoveries.
Exactly. And these advancements could have implications that extend far beyond dogs. They could benefit other species as well. The knowledge and technologies that we're developing for canine EEG research could potentially be adapted and applied to other animals, which would further our understanding of animal cognition and behavior across the board.
This deep dive has really been a journey of discovery. We've explored the complexities and the challenges and the just amazing possibilities of canine EEG. And it's clear that we're on the verge of this new era in veterinary neurology, one where advanced technologies and a deeper understanding of the canine brain are going to transform the lives of countless dogs and really reshape our relationship with these incredible animals.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.